Hello, I'm Dr. Carol DeCosta. This is the room where physical therapy is usually given to patients, and the patient in question actually had physical therapy here. Here we have Hillary Harwell, who was a physical therapist treating the patient.
Hello. The client in question has been taking physical therapy here for several months now, not really making much progress, and we had pleaded to the insurance companies to get some further testing to see what exactly was going on so we could get the proper treatment for her. And subsequently she has been denied over and over, and has not been getting better actually, and many times, many days worsening. And it's very unfortunate that if she would have had this opportunity to have these testing done, we may have been able to treat her at that time, and she may not have worsened, and she may not be in the predicament she is now to make decisions on possibly having surgery or not. So it would be nice if these insurance companies would either have someone there that could evaluate the situation and the documentation and make better decisions and make sure that patients can get the care they need, the testing they need, to benefit them, instead of stringing them on and having them potentially get worse and then be put in predicaments where they may need surgery.
Space narrowing in the lumbar spine. The CAT scan was recommended to further determine what the cause of her complaint was. I also performed electrodiagnostic testing to see whether or not there was a pinched nerve at the level of L4-5. The test did show that there was evidence of nerve root impingement. According to the radiologist that read the original x-ray, it was recommended that the patient have a CAT scan. I informed the insurance company that I'd like to have a CAT scan in April. Okay. So in April, I filled out the request from the insurance company as an authorized representative of the patient. This was in February of 2000, requesting a CAT scan. I was denied because the insurance company felt that this test was not medically necessary. I continued to request, asking for an appeal to make sure that the patient could get this particular test done. It was not until sometime in May, which is now 5 months after the patient presented and 4 months after I originally requested the test, that the patient, through the help of her primary care physician, was able to get the CAT scan. When we received the CAT scan results of the lumbar spine, there was a questionable lytic lesion in the area of the lumbar vertebrae. Usually when lytic lesions are seen, it could be cancer. Now, had this patient had cancer and it took 6 months to get the CAT scan approved, the patient may have had metastasis and she could have had serious repercussions. We then, due to a recommendation by the radiologist, we had a whole body bone scan, which showed that at that level of the vertebrae there was a compression fracture, and we were able to then send the patient on to a spinal specialist. The patient may have to have surgery, which was recommended by the spinal specialist. Now, had she not waited 9 months almost at this time to have more definitive intervention and more efficient diagnosis, the patient could have been better. I don't know, but I really think that with a public health insurance option, having the option of choosing an insurance company which is not profit-based, the patient may have had the CAT scan earlier as well as a bone scan earlier, and probably could have had surgery not being an option.